To you, and we are discussing addiction, and addiction in particular to over-the-counter and prescription drugs. Joining us and still with us in studio are Mary Byrne, founder and director of the Ashton Group International, and Darragh O'Loughlin, president of the Irish Pharmacy Union. We've had tons and tons of people's stories about this, about the times that they felt that either they went over the line or the GP went over the line in being a bit, as Ivan put it, trigger happy with prescriptions, and particularly people telling stories about Solpadeine. And obviously people want their anonymity maintained when they're telling these type of stories, and I want to bring you the experience of another listener. This recovering Solpadeine addict talked about his experiences with all of this.
Well, I was just taking it for headaches and all, and then I was going through boxes and then every day. And I'd use I'd get one, say, in the morning time, and then I'd probably have two left out of a 24 box the next day. Taking them, you just sit there, just taking them makes you just relax and just sit back and you'd veg on the chair, I had to stop taking them because my heart, you could feel on your chest, your heart was just beating all the time, beating too fast. Very big problem, it's so easy to get them. They say you can't get them over the counter, but you can. You just have to go in and just ask for them. They'll just tell you, don't take them more than 3 days, but so you're not going to listen to them. If you're in the city centre, if you're walking past it, a chemist, you just went in and grab a box, like going in and grabbing a box of cigarettes.
OK, that was one person's experience. Darragh O'Loughlin, president of the Irish Pharmacy Union. Elsewhere, let's look abroad to how they regulate this, because if I go to a doctor, they take out the chart and look at the last time I was there and whether this is something that reoccurs. If you're in, or if they prescribed something the last time, if you're in hospital, they have a chart monitoring everything you were given. Is there any type of monitoring of who's buying what and in what type of bulk? There isn't in Ireland, but is it done elsewhere?
Yes, in France they have a system which they call le dossier pharmaceutique, which is a computer online system. It's in every pharmacy, so every patient has a smart card in their wallet and every pharmacist has a smart card in her pocket. And when you walk into a pharmacy to buy a non-prescription medicine or to have a prescription filled, you put your smart card in one side of the card reader and the pharmacist's card is in the other. Both cards have to be present for the screen to work, and then your medication history across all the pharmacies in France that are registered in this system will come up there, and the pharmacist can see before they dispense your prescription or give you the new medicine what you've been on previously. They can work out if what you're taking is safe with what you have, or indeed if you're taking too much of something. So there's a safety check there which would prevent what that last caller described, which is being able to pop into pharmacies and spin a story to get a medicine.
And that also, I presume, puts the pharmacist's stamp on it, so you can see who has been prescribing or who has been selling.
Yes, it identifies what you've had and from which pharmacy you collected it, and in the case of prescription medicine, which doctor prescribed it. Similarly, in Australia, they had difficulties with a medicine called pseudoephedrine, which people were cooking up in home labs to turn into a methamphetamine, which is a highly addictive illegal drug. And to track people were coming in and literally buying this stuff, pseudoephedrine, in bulk. And there was a significant problem in the east coast of Australia and Queensland. So the pharmacies there implemented a system, which is another online system where you come in, if you want to buy that medicine, you produce ID, government ID with your number on it, say your PPS number or your driving licence number. They enter that number into the computer system and it just says, Chris bought 3 packets of this last week and 2 packets the previous week, and the pharmacist will know not to supply it and to talk to you about your usage of it. And that has managed to cut down on the amount of illicit use of that particular medicine.
OK, Mary, listening to that type of system or that type of regulation, it's only part of the problem, isn't it, that would fix, but it certainly seems like internationally there are extremely high standards for dealing with this.
There are. I think one of the points that always comes up for me in Ireland is how much we actually depend nowadays on prescription medications, and absolutely there is a place for them in line with other medications, and people do need to have support sometimes in that way. I feel that we depend too much on it, and we've actually, I would question the amount that the pharmaceutical industry has actually plied all their products into Europe, because there is the UN and that is looking at the big rise in addictions across Europe with prescription medications, and we have to remember that this is a very big business. It's a very big business. We know we've seen corruption in all other areas. I would question as to why that some of these things are first in line. as against maybe a drug-free approach to a problem. And Sweden, for instance, has the lowest rate of drug use in Europe, and they just don't have this type of situation going on. We've become very money-orientated, I think.
Let me bring you through what some of the listeners have been saying. Loads of different views on this. I worked in an addiction service in Wellington in New Zealand a few years ago when Nurofen Plus was available in 100-tablet boxes over the counter, and we regularly had to detoxify patients from codeine. Your lucky people are drugged to the eyeballs, or they would have a rebellion on your hands, said somebody. Not sure who that lady is, but she's plain wrong saying GPs have no training in counselling and addiction, said Connor.
I said
some. Okay, I'm a drugs worker, and the overprescribing of benzodiazepines is rife. They are the second most problematic drug I see.
Lots more. My mother died of an overdose, and her doctor, who was not my doctor, came to me the following day with Xanax. I never took them and is extremely bothered that he did that, says Kate in Carlow. Would the logical solution not be to set up a system that pharmacists can log on to, an integrated system where all pharmacies in Ireland can view previous drug records of the person coming in for a prescription, Darragh?
Like we just spoke about in France.
That works well. Okay, the recovering sulfidine... I take 4 Tylex and 4 Tramadol each day for the last 10 years. How do I know if I'm hooked, and what are the side effects? I suffer with back pain. Yeah, what is the ready reckoner, the rule of thumb, Darragh, about how much is too much?
Well, there's a great palliative care consultant in Galway Hospital, Dr. Dimpna Waldron, and she's given a number of lectures to pharmacists and to GPs, and one of her lines is that the best antidote to addiction is pain. So if that caller has genuinely got ongoing back pain and requires those pain relievers to prevent that pain from debilitating them or from impacting on their quality of life, then they're better off with the pain relievers than without them.
And is it a case, if you get off the legalised drugs, that should be fine? Can permanent damage be done?
If you're on prescription drugs, well, if you're taking them... like, for instance, there are guidelines as to how long you should be taking them, and we're finding that some of our clients are, or I should say people, are on medication longer than it appears they ought to be on it. But I have to say that even if you regulate this system, the difficulty we have is at the very starting point where people are being prescribed the medications in the first place.
Darragh, lasting effects?
Alternatives.
Yeah, just to touch on that, some of the difficulties there, and your callers are talking about Nurofen Plus and Solpadeine, they're combined with other pain-relieving ingredients. So Solpadeine has paracetamol in it. If you're overdoing paracetamol, you're going to do damage to your liver. Nurofen Plus has ibuprofen in it, the anti-inflammatory. If you're overdoing ibuprofen because you're trying to get the codeine that's in the product, you're at risk of gastric bleeds and ulceration and kidney damage. So the damage that can be done is often not the ingredient you're looking for, but it's something else that's in that product. And I would really encourage anybody who thinks they have issues with any of these medicines to talk to their pharmacist or their GP, who will point them in the direction of some treatment centre, be it Marie's or be it some other local centre.
Okay, I would say there, by the way, if they are pointing them in our direction, that someone needs to give us funding, because we haven't got any for the last 2 years. So that's a big problem you have there.
Lots more texts. I've been taking a sleeping tablet for 20 years. I only sleep for 4 hours a night and look like an addict. My hair's falling out, I feel very down and hate going to the shops because I'm hounded. My doctor always says no problem, and my anxiety makes it too difficult to give up. Anne says, my friend just has to ask her doctor, and she gives her a prescription for a large supply of Solpadeine, which she then distributes to some of her friends. I was shocked when she handed me 2 packets like sweets. This is normal and rampant where I live. And finally, I work in a pharmacy. We really need to push codeine on prescription. It's a huge problem in this country. We're trying to manage the situation, and it's just not working.
Yeah, fascinating stuff. It goes on, and thank you very much for our guests, to our guests for coming in to us today. Darragh O'Loughlin was with us, President of the Irish Pharmacy Union, and Mary Byrne, Founder and Director of the Ashling Group International. Thank you both. Fascinating to listen to you both, and thank you everyone who sent us in their stories and their comments.